Hello everybody, this is Gary. Today is May 10th, 2024. It is 5:57 p.m. Eastern Standard Time in the United States in Rochester, New York. And this is my Coping with Schizophrenia blog entry for today. Today has been a pretty rough day, but I got some good news. I had my COVID-19 test done yesterday, and it came back negative. So we are going ahead to prepare for surgery on May 13th. I don't know the time yet. I only know the date. I won't know the time of surgery until they call me on Thursday between 3 and 5 p.m. They will give me the time of surgery, and that's when I will have surgery. So we're going ahead with surgery on my knee. I have a torn meniscus and loose cartilage in my knee. It's been very painful for about 5 or 6 months, and I've been waiting to have the surgery done. So it looks like we're going to go ahead and do it. I saw my therapist today. I had to talk to her about my paranoia and my anger. I was on the bus today, and somebody said something to me that was rude. I didn't say anything back, even though I wanted to punch the guy in the face. I didn't. I said something nasty to some old lady because she was staring at me. And so that was on the way to see my therapist. So I told my therapist what happened, that my anger is a problem, my paranoia is a problem, my auditory hallucinations are a little bit more vivid today. I'm hearing voices and they're louder than normal. I hear these voices as actual voices outside of my head. So my depression is pretty severe. My anxiety levels are really heightened and agitated. I feel like people are watching me wherever I go, following me, picking on me, abusing me, verbally abusing me, even if they're not. After I left my therapist's office, I saw an SUV parked outside the clinic. It was parked at a weird angle, and it wasn't in a parking space. It looked like they were spying on me, like I was being watched. So my paranoia is really, really, really bad today. I'm in control of my behavior. I'm not violent. I'm not suicidal. But it's been a very rough day. I'm seeing my psychiatrist, I believe, on June 2nd. That will be my last appointment with this psychiatrist because I'm getting a new resident psychiatrist. The psychiatrist I have now has finished his residency at the clinic that I go to, so I will be getting a new psychiatrist, which is also stressful. I've gone through this 4 or 5 times already, changing psychiatrists when the resident finishes his or her residency. So I will be getting a new psychiatrist in the next 2 months or so. I have an appointment with my therapist on June 1st, but I'm going to have to reschedule that because I have a post-op appointment with a nurse practitioner on the 1st of June, and I can't have 2 appointments on one day. They're too close together. I don't have time to get from one appointment to the other. So I'm going to have to reschedule the therapy appointment on June 1st to a different date. And also I have a dental appointment on the 2nd, which I'm going to have to reschedule because I have a psychiatrist appointment on the 2nd. I have a lot of appointments and I'm trying to juggle a lot of different things. I'm under a lot of stress. So that makes my paranoia worse, it makes my anger worse, it makes my anxiety worse. It makes my ruminating thoughts worse, my obsessions worse. So things are pretty stressful right now. But I've been able to avoid going to the psychiatric emergency room. I haven't been there since October 30th of last year. So it's been a while. I don't think I need to go to the psychiatric emergency room. If I go to the psychiatric emergency room and they hold me there for 2 or 3 days, that's going to interfere with my ability to have surgery. So I'm not going to the psychiatric emergency room because I'm not violent and I'm not suicidal. I'm just very, very angry, very, very anxious, and very, very paranoid. Um, and I'm just dealing with a lot right now. The weather was nice at least today here in Rochester. It was 60, 70 degrees outside. It's sunny. Didn't have to wear my winter coat for the first time in a long time. So the weather's nice. I decided not to buy an air conditioner this year. I'm just using a lot of oscillating fans to keep my apartment cool, keeping the window open to let the hot air out, let fresh air in. But that's pretty much it. Surgery, like I said, is scheduled for Friday, May 13th. Didn't do much else today. I was too distracted and angry about a lot of different things. Just trying to keep up with all my medical appointments. It's been difficult. My psychiatrist did raise my Zyprexa from 10 milligrams a day to 15 milligrams. We left the Klonopin as it is 5 or half a milligram twice a day, and we kept all my other medications the same. I'm picking up a couple of prescriptions tomorrow for the Neurontin and the Klonopin. But I feel very, very, very agitated today. Not doing real good today. I'm safe. Everybody around me is safe. I'm not harming anyone. But I'm just like really pissed off at the world right now. But that's all the report for now.